It's a global health crisis now hitting close to home. Coronavirus is in Florida, and we're here to help you separate fact from fiction and help you keep you and your family safe. You're watching an Eyewitness News special, Coronavirus. Your questions answered.
Hi, folks. We are dedicating the next hour to bringing you crucial information about what's happening with coronavirus and our community. Good evening, and thanks for joining us. We are live here tonight. I'm Greg Warmoth.
And I'm Martha Sagowski. We know this is a subject that just so many of you are talking about right now and watching so closely. We have a team of reporters gathering the very latest information on what's happening with the illness and infections across the country, what local schools are doing to protect students, and what this all means for people traveling into or out of Central Florida.
And you can see behind us, we have gathered public health experts and local government, school, and transportation leaders. They'll be here to answer questions that you've sent in and talk about what's being done here at home. We appreciate all of you being here tonight, and we'll talk with you. And Vanessa Eccles will have some questions from our viewers in just a moment. We'll also want to hear from you. You can reach out on social media as well.
That's right. You can call our media partners at News 96.5. That number is 844-220-0965. Now, at this hour, we know a total of 9 people linked to our state, Florida, have COVID-19. Today, Governor Ron DeSantis announcing 5 Florida residents are held up in Washington because they have tested positive.
He also said a man in Santa Rosa County, now that is in the panhandle area, is presumptive positive for the virus. We're joined now by Channel 9's Lauren Seabrook, who has followed every new development in this major story since early last week. She's in the studio with us tonight, as you can see. And Lauren, state health officials continue to say the risk here, right where we are, is low tonight.
Right, Greg, and they also say even if you do get it, it likely won't be that serious for you unless you are elderly or if maybe you have some underlying medical issues. But out of nearly 100,000 cases worldwide, about 3,300 people have died from this virus. Here in the U.S., we've had about 100 cases and 10 deaths. Thankfully, though, here in Florida, no one has died. Before COVID-19 traveled around the world, it started in Wuhan, China. On the very last day of 2019, a patient there became ill with pneumonia. A week later, it was identified as coronavirus. And 2 weeks after that, on January 21st, it was in the United States. The outbreak was then declared a public health emergency of international concern.
I was thinking, when's it going to happen? I actually thought it would hit Florida first of all.
Washington was actually the first state with a positive case, and it wouldn't be long before we had one here. The first positive test in Florida came Saturday, but the State Department of Health didn't announce the case until late Sunday.
In terms of letting the public know that this is coming and how to prepare ourselves, and
Monday, the state declared a public health emergency to get resources ready to handle the threat. By Tuesday, we had 3 cases in our state. A man in his 60s in Manatee County who was in the hospital with pneumonia had not recently traveled out of the country, and health officials are still investigating how he picked it up. The other 2 cases are sisters in their 20s who recently traveled to Italy, and now a man who lives in the Panhandle and has severe underlying health issues has it too. Orange County health officials say as testing is expanded here, we might be next.
We believe it is a matter of time before we have a case right here in our backyard.
A vaccine is currently under development, but Florida Surgeon General says it's more than a year away from being ready. So far, the virus has been fatal in 2% of cases, but
if you don't have an underlying health condition and you're not elderly, so far, you've seen very few really serious cases.
A recent study published in the New England Medical Journal also says it appears children under the age of 15 might be resistant to it.
The folks here at Orange County Health Department, they've been in contact with Disney, the other theme parks, the hotels. They are going to be in further contact with senior citizen nursing homes and assisted living facilities.
Now, we also learned today the federal government is sending tens of thousands of test kits to Florida so they can start testing people in hospitals and doctors' offices. We've been waiting for that for a while.
Now, Lauren, this response is already adding up for our state. The governor already said that we'll likely have to be dipping into the state's reserves.
Right, Martha, but he also said that he believes all of Florida's expenses will qualify for federal reimbursement, so we'll have to wait and see how that turns out.
Right. It is kind of our next hurricane in terms of our preparedness, the money we're going to have to spend and keep people safe. It's very similar. Thank you, Lauren, for that report.
All right, we've also been